This conversation was recorded July 24th, 2020. Hello, everyone, and welcome back to our interview series with people from the hepatitis C community. I am back with Daryl and our next guest.
I want to introduce a friend and a colleague who's very much engaged in working in the Hep C community, both here in BC and in Saskatchewan. Lesley Gallagher, a Hep C nurse. Hi, Lesley.
Hi, Daryl.
Hi, Lesley. Thank you for joining us today.
My pleasure.
Is there anything else that you want to add and tell people a little bit about yourself and the work that you do?
I guess my work pretty much is focused 100% of the time on hepatitis C. Hepatitis C care, treatment, engagement, all the challenges involved with interfacing with patients who are living with hepatitis C.
So Lesley, what brought you to this work? Can you share with us?
I guess I was working in the HIV field. I'd started working on a HIV vaccine that I was coordinating here in Vancouver for about 4 years. And so that concluded unsuccessfully. And I started to get involved along the same lines of infectious diseases with hepatitis C. Pegylated interferon had come out fairly recently, and treatments were certainly complicated and arduous, much unlike today. But patients needed a lot of support through treatment and even identifying and educating. I kind of got more and more involved from I guess 2003 in the downtown east side of Vancouver. And then in 2005, we started a Hep C support group, first one in Canada, that's run every Friday until March of this year, 15 years.
Wow.
So I'm very invested in hepatitis C.
Yeah, we're glad for it.
You mentioned the hepatitis C support group. Can you tell us more about the work that you're currently doing and what your involvement is at this point in time?
So in the downtown east side of Vancouver, Hep C treatment had kind of started. People were starting to get experience with treating back in maybe 2003, 2004. But it was mostly unsuccessful attempts. Individuals who had a very difficult time staying on treatment. So we started a Hep C support group based on Diana Silvestri's support group down in Oakland, where she was treating people that were actually homeless, and she was treating them successfully for hepatitis C. So we modeled our group after that one, working with a group of primary care physicians and addiction specialists, as opposed to I guess, GI specialists or ID specialists. And yeah, a group just kind of took off. And then when I later moved to Saskatchewan to continue the Hep C work and start a program there with Dr. Stewart, we started a Hep C group there that ran every Monday at lunchtime too. So that was, I guess, started in 2014 in January. So we've run that every week since as well. So it seems to be a great foundation to a program because of the fact that people don't need referrals. They can drop in. There's one commonality, and that is the fact that they've all been touched by hepatitis C in some way.
That's excellent. And it's so great to hear from, someone who's been involved in research and treatment, and who's also providing that social support and the tangible support that people need to successfully complete treatment and handle everything else that comes along with having hepatitis C, or other factors in their lives that they just need peer support to help navigate.
Yes.
So Lesley, we all have challenges and successes in our work, of course. And can you share some of yours?
Sure. I guess in the realm of hepatitis C, thinking about how far we've come and where we are now and looking to the future, particularly looking towards 2030, where we're looking at elimination of hepatitis. I think that the successes have been small, little milestones. I think probably being able to take the program that was initiated in early 2000s in Pender and recreating that into the urban addiction field within Vancouver as well for individuals that did not want to come down to the downtown east side for care. So that model of care sustained itself for, I guess, 12 years until, I guess, December of 2019. And then in 2013, being invited and me accepting very reluctantly to go to Saskatoon, Saskatchewan, and work with a physician there who saw a real need in that northern part of the province for Hep C care, education, awareness, in a province that actually has the highest numbers per capita of hepatitis C, that it was rapidly, going out of control. So I guess that was I consider that a big success, starting that little program in that little clinic and being able to go into reserve communities, being welcomed in, organizing liver health events, traveling, always delivering the consistent, same messaging. I think that's what's very important. And I guess just treating individuals with respect, trying to see people from where they're at, and trying to be kind and treat hepatitis C.
So do you see micro-elimination, and do you understand what that means, of course, doing your work in rural northern communities? Do you see that as a good tool going forward for elimination, or at least one of?
I think that's, yes, definitely. I think it's very important that we undertake our activities on a infinite level. We don't do anything finitely and go in once or twice. We've got to be very consistent, which means you've got to have an infrastructure in place so that you can continue and keep going back. Hepatitis C is not something that we just cure. Hepatitis C can be recurrent. People become reinfected. This is something that we have to just keep managing, and without any stigma or judgment. And I think that's the only way we're going to proceed towards elimination. Dr. Feld recently said that he thought, he was cautiously optimistic that perhaps we're actually going to be able to meet this milestone by 2030, looking at treating upwards of maybe 10,000 individuals a year, annually, across Canada. And I think that in Saskatchewan, we're definitely looking at around 1,000 patients in that province every year that we've been treating in the last 2 years. So I think hopefully this year is not going to impact us too greatly, but I can say that I think Saskatchewan's been holding their own with the 10% for the 10 provinces across Canada. Of course, we know that Ontario and BC have a higher proportion of numbers. I think when we think about new infections and numbers treated, it can be quite overwhelming because these numbers do not somehow coincide on a plane where things could rapidly spiral out of control. I think if we keep our messaging going forward, unfortunately, this is not just towards patients, but it's also towards healthcare providers. Healthcare providers, we're not seeing patients tested early enough. We're not seeing patients moved into treatment early enough, or at all. So I think that because nobody's telling us what to do in our little communities across Canada who were involved with hepatitis C, nobody's telling us what to do. We've got to figure it out ourselves. We've got to plan our own outreach activities. We've got to, do our campaigns, such as the one that you're doing now, Daryl and Carrie. There's nobody leading us. There's no health authority telling us what to do or mandating, or no government. So we're really on our own out here.
So I think that leads us in very nicely to our, next and sort of final question, which is, what do you see for the future for your work for hepatitis C? What do you see on the horizon?
Well, there's a lot of players in BC. There's a lot of powerful individuals in BC who, and I don't profess to be, able to move, mountains the way that some of these individuals can. So I think that I'm happy to do whatever is necessary or where I can help out in BC. But I think in Saskatchewan, it's kind of a bit of a frontier. So what I'm really hoping in Saskatchewan is that I can help the nurses of Saskatchewan rally to be that steering committee that we need to move towards elimination. I think that in BC, we've got, some power up in the north. We've got the island. We've got certainly the urban areas in both like Kelowna, for example, and Vancouver. I think that with some coordination, a lot can be done. But I think that if I can somehow get these nurses on track to really, like suffragettes, if we can be the ones that can go in there and try to organize something in Saskatchewan and look at our numbers for treatment and incentivizing individuals to bring in their partners, their friends, and be very consistent with our care, I think that that's where I want to go in the near future.
Awesome. Thank you so much for all of the great insights and just sharing about the extremely important work that you've been doing over the years and what is growing and to come.
Thank you. And thank you for allowing me to verbalize my thoughts, because I hadn't really, sat down and talked about this before. So thanks very much to both you and Dale.
Thanks, Lesley. It's great to see you and hope to see you again soon. Keep up the great work.
Learn more about viral hepatitis and the BC Hepatitis Network by visiting bchep.org and contact us at podcasts@bchep.org. You can also find us on social media via the links in the show notes. For more episodes, visit bchep.org/podcasts or subscribe on YouTube or your favorite podcast app.